Hello, my name is Dr. Schola Matovu. I'm a nurse, an assistant professor, and a co-founder of our nonprofit, Nurse to Nurse Global Initiative, or NTNGI. When I got the honor of being admitted to the WomenLift Health Leadership Journey, I proposed to design and implement a leadership and professional development program for NTNGI. Grandiose, right? I know, but I didn't plan to achieve that goal alone. I had numerous objectives and skills that I planned to acquire from this program. But little did I know of the life-changing journey that my incredible cohort and I were about to embark on. You see, our nonprofit's mission, in part, is to support the largest healthcare workforce that is nursing, especially the unsung heroes who work in under-resourced settings and who have worked under extraordinary circumstances way before Ebola, or the current COVID-19 pandemic. And yet they're of the belief, I'm just a nurse. Our findings from a preliminary needs assessment revealed multiple challenges experienced by these nurses, including nurses feeling undermined by their interdisciplinary colleagues, especially given the predominantly masculine culture in which they're embedded. And so the problem that we set out to solve is this lack of empowerment, resources, support networks, and leadership development opportunities that would otherwise allow these nurses to effectively advocate for themselves and for their patients. Now, part of the WomenLift activities involves stakeholder mapping, which enabled us to identify key actors and potential funding opportunities which would support our initiative. We quickly realized that we needed to rethink our strategy. Evidence suggests that the challenges experienced by these nurses are better solved by empowering them through joint action and meaningful engagement. And so we propose to develop a collaborative online transcultural education program that is designed to promote health equity through leadership development training. Our new strategy is informed by a collective impact approach, which involves identifying partners with a common agenda and facilitated by a backbone support organization. We leverage our existing network at my home institution, University of Utah College of Nursing, and Aga Khan University School of Nursing and Midwifery in Uganda in order to advance our shared mission. We positioned our nonprofit to be the support organization that will facilitate the collaborative process. The proposed program will be delivered in a transcultural or global classroom setting in which collaborations among participating faculty and nursing students or nurses are fostered through leadership training. We are currently continuing to engage with partners as we plan to launch our pilot training this summer. We invite you to support our mission to empower these frontline heroes. And when all our short and long-term goals are achieved, especially securing funding for our proposed program, we will realize our vision of a global community in which nurses are empowered to provide quality patient care with cultural humility and can lead initiatives with authenticity, equity, inclusion, and justice for all. So, what are the lessons that I've learned from this journey? Well, they're numerous and immeasurable. But above them all, I am fired up with confidence and courage. And I've always been that way, but I am rejuvenated. I have the confidence to speak up and advocate for the voice that is not in the room or at the table. For example, advocating for more African American voices in the global health arena. I have the courage to ask the uncomfortable questions of myself and of others. For example, I have the confidence to ask you, my white or white passing colleagues with interest in or already work with communities to which you're an outsider. How do you use the superpower that is your white privilege? I have the courage to ask you, my colleagues in the Global South, how do you use your power? Have you identified it yet? I have the confidence to ask you, my colleagues in other disciplines. For example, medical doctors. Do you have the courage to advocate for more nurses, not only at the bedside, but on the global health panels to which you're often invited, or tables where key decisions are made that impact patient care? I have the courage to turn the lens inwards as well. I am mindful of the privilege afforded to me by my duality as a Ugandan American. I am intentional about leveraging that privilege to support my local partners in Uganda, to whom I am grateful and acknowledge the expertise that they have to offer. You see, until we are ready to find comfort in our own vulnerabilities or engage in critical reflections about our biases and privilege, we will not be able to rectify the contemporary forms of systemic inequalities that impact us and the global communities we serve. So, Dr. Michelle Berry, thank you for the courage to advocate for more women at the table. I am forever indebted to you and the entire WomenLift Health team for this invaluable opportunity. And I'm grateful to my incredible cohort for all your support and camaraderie. Thank you.